Hi, my friends. Welcome back to Peace and Plenty in 20. Today, I'm excited to bring you part 2 of my conversation with Dr. Mark Karolak. Last week, we talked all about fillers, Ozempic face, and the things that actually work. If you did not get to hear part 1, definitely go back and check that out. This week, we're diving into the big question, facelifts. When do you actually need one? What's the recovery really like? And why are women in their 40s getting them now when it used to be a wait until your 60s thing? Dr. Karolak is here to answer everything, so let's go. So the next trend versus truth is, what about facelifts? I see women having them younger and younger. Facelifts, whether you're in your 40s or your 50s, does it make sense to do that over fillers? Obviously, there's a cost consideration, but talk to me a little bit about women that are really opting for a facelift over fillers or vice versa.
Well, the first thing that people should think about or answer in their own minds is why are they doing it? Because
Mm.
my wife was showing me a celebrity from years ago who, and the name escapes me, who she just felt down on herself and wanted to do something to freshen her face up, and she was in her 40s and didn't want to have surgery, so ended up getting fat transfer, and now she's unrecognizable in her 80s.
Mm.
It's just like her face, from the fat transfer, even within a year, you couldn't tell who that was anymore. So, when you're looking at aging, if you feel that there's volume loss, I think, or there's muscle losses, you're trying to figure out what to do. The social media is a great way to start screening doctors because you're going to want expert opinions, someone to guide you through that whole process, not to try to just decide, oh, I'm going to go to this med spa and do fillers because I feel like I'm looking tired or older. Because most people are only going to use the tools that are available to them, unfortunately.
Yep.
Um, but you can quickly screen through what aesthetic each doctor has or each provider has by
Mhm.
going through their social media. Next part would be to talk to them and see, get a game plan, not just jump into it and do it because you can easily do the wrong procedures. So when you're trying to decide between, a facelift and why people are doing it earlier in their 40s, it has to do with how their faces are aging. When I started in practice 20 years ago, the average age for a facelift was 55 to 70 in my practice.
Okay.
Within 5 to maybe 10 years after that, the average age started to quickly drop to the point where now it's 42 to 60 is the average
Mhm.
age. The questions I used to get when I started in practice was, I feel like I'm too young, or am I too young for a facelift because I feel like I'm sagging. Now I'm getting patients coming in asking me if they're too old because they're seeing for a facelift because they're seeing younger patients getting it. The reason it's happening is because or why I feel it's happening is because there's so much more information out there now. People are more aware of their bodies. They're living healthier lives. They're exercising. They're, doing hormone replacement. They're doing skincare. They're protecting their bodies as much as possible. And they're doing non-surgical treatments, which some of them are limited. Some of them cause damage, which unfortunately people don't realize when they're doing it. And they think they're doing something good when they're younger to hold off a facelift, but they're realizing the limitations of these procedures and quickly starting to say to themselves, you know what, like this isn't working. And I'm maybe 45 and I feel like I have jowls and my neck is loose. So then they're looking at surgery because they're seeing that I can have a facelift if I go to the right doctor and not look weird, pulled, stretched, windblown. I could do it and no one would know, but I'll know because I'll feel better and I'll see everything that I want to improve improved. So they're more people younger ages are more open to surgery because of that reason. And then some people, my youngest patient was 36, advanced aging. The younger patients, I feel, unfortunately, is they're being accelerated into surgery by doing the wrong non-surgical procedures
Right.
where they're losing fat in their face, they're creating scar tissue, and it's accelerating their aging to a point where now they're, maybe they would have held off a facelift till they were 50, but they started some of these procedures in their early 40s, and now a year later they're at 40, 42, 43, coming in saying, this isn't working. I feel like I'm older than I was 2 years ago, and I was doing things to make it look younger.
Makes so much sense.
So, yeah.
So what, how do you, if someone comes in, right, and they have a consultation with you and they really feel ready to have surgery, but they still, and they trust you and they've done the research, but they still are apprehensive. They still feel nervous because I personally could relate to this, and I have a couple of friends who can relate to this. You as the doctor, how do you support women around, if they're scared, if they're unsure, if they're overthinking it? And the second part of that question, which I think they go hand in hand, is what questions should they be asking so that they feel more confident in their answer of yes, if it is a yes. Does that make sense?
Yeah, yeah, absolutely. So when patients come to see me, it's an educational process. So it's not, look, I think you should have this type of procedure or this type of procedure. It's all right, let's see how your aging is taking place. What is it that you're seeing that brought you in here? And then let me tell you what I see so that we can kind of come up with a plan to determine when's the right time for a facelift. So I don't believe in preventative facelifts, meaning if someone comes in and they're, in their 30s or 40s or even 50s and there's no looseness in their jawline, there's not going to be a meaningful result in surgery, but they just want to have it so, maybe they're not going to need it in 5 years. Well, they're going to get to a point somewhere down the line where they're going to age enough, whether it's 8, 10, 15, 20 years later, where surgery is going to be helpful again. So there's no sense in doing it when there's no meaningful result. There's no sense in doing it if there's a non-surgical procedure that can get as good or close to as good of a treatment or result as the surgical result. For instance, like brow lifts and Botox and lasers and peels and things like that. If someone's main problem or concern is wrinkling or smile lines, or they feel like their brow's starting to dip down, Botox is a fantastic treatment. So it helps prevent wrinkle lines from forming from repetitive movement. It can help reshape the brow. And then you can carry on like that for years without undergoing surgery because surgery itself has risks with it. So there's pros and cons to everything. And fortunately, when you go to somebody that does a lot of surgery, it helps limit the risks, but there's still
Mhm.
risks involved. So non-surgical, start off simple skincare, non-surgical Botox, small amounts of filler, healthy lifestyle. And then when they get to the point where those things aren't working and they come in and maybe they have a little bit of looseness in the neck area and it's really a concern from their profile or when they catch themselves or if they're on TV and it's really important that they have their best angle showing from each camera angle. Then you look at surgery, and surgery is a personal decision. It's the best way to decide whether it's time or not is to understand what it's going to do, but probably even more important, what it will not do,
Mhm.
because that's where I see patients get the most incredible results, and they're happy, but they could be slightly disappointed because surgery didn't do what they wanted it to do, like fix the elasticity to the skin or maybe fix a crease or a fold. When it had neck surgery wasn't the intention of what surgery was going to do. Surgery is going to make them get a better jawline, neckline. We're talking about a facelift mainly. Neck lift will give them a better neckline, jawline will give the facelift will give them a better jawline, eyes will brighten their eyes. So procedures in the right hands will do predictable things, but they won't do everything.
Right.
So it really becomes a personal decision. So it's never, I don't have anything that I say to patients to convince them to do surgery.
Mhm.
Probably the most probably one of the best pieces of advice I give them is to get two or three more opinions. Max, usually around by the third doctor, they'll have a sense of which doctor is the best doctor for them, whose aesthetic they connect with, and the personalities in the practice also. So it's just about getting the information, understanding if it's going to address the concerns they have, if it's going to, how can it be done in the safest way possible, if there's any other alternatives that are going to be as good or close to it, and what are they going to have to do to maintain it afterwards. So those are the main questions that I think they have to answer for themselves. But for me as a provider, it's not to sell them surgery, it's to give them the best result that they can possibly get anywhere, but do it in the safest way possible and have them comfortable with the decisions they make.
And I love that you encourage them to seek out other opinions because that answers kind of the question of if you're unsure, right? Or if you're nervous about it, you're now gathering your research, you're doing your own research, you're getting information. Um, and going back to what you said at the very beginning with how you are so specialized, I would think that, the women that come to you really trust you because of just how many of these you have done, how many different cases you have seen. And I know for me personally, that's very reassuring that you have someone that has that really specific experience and also is going to be honest with them, like what you just said. I also really appreciate that idea of here's the reality of what I can do and what we can do and what it's not going to be. I think that's a very important point to make. So, okay, so for my listeners, tell us where you're located, where do you do surgery? Like this is like the nitty-gritty details.
Sure, sure. Yeah, so I'm in Wall, New Jersey, which is near the shore area, exit 98 off the Parkway. If you're from New Jersey, you get that reference.
Mhm.
Um, and surgeries, most of the non-surgical things and consultations are done here in the office. And then the surgeries are done at a surgery center, which there it's an anesthesiologist putting an IV, doing IV sedation, and I'm focusing 100% on surgery at that point. So yeah,
Awesome.
that's the nitty gritty of it.
So, in terms of a facelift, what's the recovery time like?
So there's general averages in recovery, but
Mhm.
on average, it's the first week is just bruising and swelling. So patients will come see me, the next have surgery. The next day they see me in the office, and they're always seeing me throughout the recovery process as well as my assistants. But they always get to see me, and I'm going through, how their progress is going. So they see me the day after, the first day after surgery. There's that first night is usually the toughest. There's some pain, discomfort, which patients will describe the pain as not really pain. It just feels really tight and uncomfortable that first night. Tight around the jaw, a neckline, around the jawline, around the ears, and it's hard to open their mouth all the way. The That gets better each day after the first 24 to 48 hours. By day three, they are feeling a lot better, but their bruising and swelling starts to increase. So that's a really important time to remember because as they're going through it, they feel like they're over the worst of it because they feel better, but they're starting to look worse. So
Mhm.
when the bruising and swelling start to kick in more around day three, then it gets worse on day four, then day five, it doesn't look any better. And then day six, they're questioning whether they even should have done this surgery. They're never going to look like themselves. And then day seven, it's the day that it typically stops looking worse. And then they come back and see us, and we do suture removals, clean up the sutures, and then guide them through what they're going to experience after that. Also, so then by 2 weeks, that second week is visible recovery. So they swelling starts to go down to the point where by 2 weeks, usually about 20, maybe 30% of the swelling and healing is done. So
Okay.
at that point, if they have long hair, they can cover up the areas of surgery. It's by no means healed and they're not going to look their best, but they're going to cover this up and they can cover it. Maybe put a little foundation on any bruising. If they've had their eyes done, the eyes usually look pretty good at 2 weeks, but they can always throw sunglasses on or wear glasses if they do that instead of contacts.
Hmm.
Patients at 2 weeks go to office parties with their glasses on and
Okay.
maybe we may have seen a little bruise or something like that. So that's 2 weeks. When most patients get back to work or into society, by 6 to 8 weeks, that's where about 70 to 80% of the visible recovery is going to be done, at least in my practice. And this is all on average. What that means is that would be the soonest that someone would feel comfortable at a big event.
Hmm.
If they have a red carpet event, and they're by no means completely healed, are going to not feel self-conscious, but that's the soonest that they could pass at a bigger event. Uh, they'll be about 70% through the visible recovery. By 3 to 4 months out, that's going to be long-term results.
Okay.
So someone's wedding or their child's wedding or maybe like a very big event that's really important with pictures and things like that. I'd say 3 months would be the bare minimum for something like that. So there's different types of events throughout that process. And then even though the recovery or the results are pretty representative of long-term results at 4 months out, there's still little amounts of healing that go on for even up to a year. There can still be numbness that it hasn't gone away. There can still be a little swelling along the back part of the jawline, but most people don't even realize it until they see themselves a year later and like, wow, I have more definition here, or my face got a little bit more narrow here, or look how much tighter and or more defined my neck looks. Those are all like the little things that I usually pick up on, but most patients don't see it until I show them in their photos.
Which is so cool. I can imagine being like, oh, what, like little gifts along the way, like
Exactly. Right.
realizing just how awesome it was.
Yeah.
So to everyone watching and listening, in the show notes, I'm going to put links to Dr. Karolak's website, to his Instagram for sure. Is there anyone or anything they should look at in particular? Like, is there anything you would want to point them to and say, look at this, or just scroll through the whole Instagram?
I think scroll through the whole Instagram. There's going to be educational things on there. I've just been so busy with surgery,
Yeah,
sort of.
exactly. Who has time to do social
So
media?
I'd say, and I do my own social media. So fortunately now we have a nurse practitioner who's taking over a lot of the non-surgical things that I've been
Great.
doing. So she's helping me out with freeing up and kind of guiding me towards more of the um, educational videos and things. But if you scroll through everything, one of the things that'll stand out most is you're going to see patients of all different age ranges, different body types, different size faces, shape faces, and one thing that's going to resound throughout is that they all look like themselves, and the results are far from subtle.
Absolutely. Thank you so much for taking the time to be here and to talk to my women because this is definitely a topic that is on everyone's minds as we start to age. And again, I appreciate you taking the time to share your expertise and your knowledge. And maybe I will see you in your office in the near future.
I would love to see it.
All right. Thank you again, Dr. Karolak. And
Love for
for
time.
the rest of you guys, I will see you next week for another episode of Peace and Plenty in 20. Be sure to hit subscribe if you're not already subscribed so you get new episodes every week. Bye, everyone.